Hello, and welcome to Learning Environment with focus on moving to action. This resource has been created by Pam Emery, School Climate Social Emotional Learning Consultant with the Pennsylvania Department of Education, specifically the Office for Safe Schools, as well as myself, Jim McDonald, Director of Resolve Behavioral Health Services with Colonial Intermediate Unit number 20. The goals for moving to action include: how do we create and use data that is available in a strategic manner? Through needs assessments that are readily available and easy to use, identifying what our data is telling us. Maximizing the resources we have available in our districts or schools through a resource mapping process. And finally, as we begin to move through a process of COVID recovery, understanding that the pandemic has been impactful to all, how do we address self-care as part of staff capacity? Knowing that our ability to execute any of the action plans derived from this work, our staff are critical in our ability to successfully execute meeting the needs of our students. Before we move forward with our work here, Pam and I want to address some prerequisite assumptions that will add context to this presentation. One, to maximize benefit from this presentation, it would be helpful to first view the Planning for Success learning environment. Two, understanding that data is essential to any action planning process. And with that in mind, that schools or districts have already gone through an assessment process such as SHAPE or School Climate and now have data available. Learning environment teams. This slide represents guidance for selecting a learning environment team with emphasis placed upon cross-discipline representation to facilitate a more robust process. Also important with cross-discipline representation is the concept of giving staff a voice in this process, also contributing to a more robust process. In addition to the suggested team member positions that you see here on your screen, we'd also like to offer some guidance in picking your team members. We would suggest that representatives to this team be viewed as persons that demonstrate high levels of emotional intelligence, who are supportive of students, that the recruitment of team members should be in alignment with the process of that particular team and the purpose of that particular team, and that it also may be helpful to identify representatives that are also participating in other teams in your schools or your district, such as PBIS teams, MTSS teams, SAP, School Climate, Safe to Say, Crisis, et cetera, would also be helpful in your selection process. This slide represents guidance to assist with creating a process and steps that are recommended to be followed for optimal results. By offering a process and/or steps, this will allow for more immediate readiness for the team to engage in the work around this initiative. Once the team is identified, next steps for consideration include: first, identifying one person as a point person. This person would be responsible for team cohesion and movement, plan development, as well as accountability to central administration. Two, determining and drilling down the data sources that will be used to guide this project. Three, reviewing the data in an effort to identify trends in strengths and needs. Four, important for manageability and efficiency, prioritizing only 2 to 3 areas that a team would like to target. 5, creating actionable plans that are observable and measurable that allow for data to guide this ongoing process and the decisions derived from such. 6, as the action plans are being created, we would encourage you to consider any connections 2, or implications for the district's comprehensive plan. 7, this is really hard work that is also very relevant, valuable, and important. Take time to celebrate successes by sharing out with the entire team and school community. 8, create agreed upon intervals for regular review of ongoing gaps and alter the action plans as needed. 9, once the goals are completed, move on to items that were not originally prioritized when this team first convened and repeat steps 1 through 7. As an additional resource that can assist with these steps, please review the Teaming for Success learning environment, which is available on the Equitable Practices Roadmap as an asynchronous session. The team session will walk you through development of a team and alignment of teams in districts and buildings. Thus far, you have heard reference to data being integral to this process. So let's talk a little bit more about why we use data. Data allows us to identify strengths and concerns. It allows us to identify root causes. It allows us to use energy and resources on needed solutions. It allows focus on solutions that are data indicated and driven towards need. It allows support and guidance for decisions to be made, and it supports equitable practices. It allows for the examining and disaggregating of the data. Data becomes the constant that facilitates and informs decisions and lays the groundwork for plans that are sustainable. Once assessments such as school climate or SHAPE have been completed, and/or when the team is reviewing data that may already exist in your school or district, such as PBAS data, local assessments, school attendance, etc., your team may now be identifying gaps in the data that are likely to exist. Once the team has identified the gaps, the team is now ready to begin disaggregating the data. In this slide, we continue to offer more examples of data where gaps may exist. Importantly, our examples here and on the previous slide are mentioned as they are commonly available and accessible to most schools and districts. At this point in the presentation, I would like to introduce my colleague, Pam Emery. Thank you, Pam.
Hello. I today would like to also discuss the use of data. And when we think about data, now that you have considered data sources and are taking steps to review the data, look for trends, and disaggregate that data, we want to talk about thinking of that data in terms of the 3 categories of a tiered system of support. Most schools are utilizing some system of tiered support for their students, whether it's formally through PBIS or informally through practice. This slide represents universal sources of data. When you think about a tiered system of support, universal represents all students, and the data that you're looking at, such as school attendance, local assessments, local surveys, absenteeism, PBIS data, etc., represent data that would be provided for all students. This slide represents sources of data and resources that can assist with action planning at the universal level, which is that level of all students. These resources are not an exhaustive list. However, they should be considered when you're reviewing resources for action planning. Some of the resources listed here would include your Patten, your local Patten, and your contact at Patten for consultation, your local intermediate units, which are readily accessible and available to you. There are many PDE resources as well. There's a guide from the Collaborative for Academic and Social Emotional Learning on how to use SEL critical practices and look at equity-focused strategies, as well as the school mental health curriculum, and many, many more. So as this is not an exhaustive list, it is an excellent list as you consider your next steps as your data is reviewed. This slide represents strategic sources of data that can be utilized with student populations that are receiving targeted supports within that tiered system. And if you're thinking about the tiered system, you might call them level 2 students. These supports and the data that they provide can also be used as you consider action planning and you consider that group of students. This slide also represents those parts of data or pieces of data that would align with consideration and action planning for students at the strategic level. This slide represents data that can be gathered from that tier 3 level or intensive level of support for students that require intentional, strong supports. Data at this level for action planning can include, SAP referrals, mental health referrals, discipline referrals, special education referrals, any type of local surveys that you may have around students at this level, as well as response to intervention at this level. This slide also represents intensive data point resources for those students that are considered really needing those strong supports. And when you look at this slide, you need to consider your intermediate unit consultations that you may have had about the student or the student's issues regarding also supports and local mental health providers, county offices of mental health and developmental services, county health choices and representatives, county managed health care organizations, as well as local hospital networks and local nonprofit providers, depending on your community and the types of supports and relationships that you have at that intensive tier or level. Once you've categorized your data sources into those aforementioned categories, you are ready to begin the action planning process. The benefits of the action plan are very, very clear. And creating that action plan really does assist team members with having a common roadmap to follow and allows for clear direction It also allows for and provides and delineates the steps that need to be taken to reach your goals of your direction. It also provides when the steps that need to be taken to reach the goals should be done, and obviously what needs to be done. So those are very, very important and really help to clarify what has to happen. Why we do this is to be able to stay motivated and committed throughout the process, and also to be able to review the process and prioritize your goals based on the effort and impact of your actions. So when you create an action plan, these are the elements that really need to be included in that plan. They would include your description of the goal or goals to be achieved, the steps that need to be carried out in order to reach the goal, who will be in charge of carrying out each of the tasks in those steps, when those tasks or those deadlines will be, when those tasks will be completed, and any milestones to consider as you are looking to complete the tasks, what resources need to be added in order to complete the tasks, and then how you will evaluate your progress. What measures will you use? What data will you use as you work through your action plan to ensure that you are staying on task, that you are looking at things in an equitable way, and that you are achieving your goals, and that you are staying focused on those goals. When considering needs and a process for support, self-care and staff capacity cannot be ignored. One of the areas that should be conducted as you consider self-care and staff wellness would be to create a needs assessment in that area as a first step in being effective with students. That needs assessment and what it will provide will assist staff in looking at themselves, looking at their needs and their needs as a team, and then determining what they need to do in order to take care of themselves, and for their effectiveness with their students. Once that needs assessment is completed, that action plan that I alluded to should be done with staff input and should be monitored, as we discussed earlier. One of the resources that the department has provided is a roadmap for school leaders that will assist in pulling all of the pieces in this presentation together, so that the school leaders especially can be proactive in planning and can do it in an efficient way as they work and lead their staff. Included on this slide are dates for additional information in the development of supporting learning environments. Okay. Also, this slide represents collaborative check-in sessions that will be provided to assist with your planning. This slide represents resources that can be utilized for action planning for staff wellness. So this would be things such as creating staff shared agreements, which is a tool for co-developing agreements about how staff is going to work together, communicate, and interact to achieve those shared visions that could be identified in your needs assessment, as well as the staff's needs assessment for wellness. Listening as a leader is oftentimes one of the best things that can be done to promote staff wellness, and that communication piece is critical. The educator context and stress spectrum can also be utilized, as well as support for teachers affected by trauma. All of these resources, again, are not exhaustive as a list, but are certainly excellent when you consider action planning around staff wellness. This slide represents additional resources for data analysis and action planning. There are many that can be accessed on the Equitable Practices Hub, as well as the PDE Staff and Student Wellness Guide. There is the Empowerment Through Common Language in Pennsylvania, a dictionary of terms. This becomes really critical as folks look at action plans and define those plans. That language is very important, that common language be used. And then finally, there is a data reflection protocol from the Castle School Guide that allows teams and other stakeholders to look at trends and discuss ideas for continuous improvement. So beyond the current, to look down the road and know how to do that. So that's also extremely important.
Okay, this concludes our presentation for social and emotional wellness, specifically moving to action. Please be sure to follow the directions listed on this slide. Both Pam and I would like to thank you, wish you all well, and hope that you found this information helpful